Dr. Nestor Demianczuk is a faculty member in the Department of Obstetrics and Gynecology at the University of Alberta. His clinical practice and research interests focus on maternal-fetal medicine, and he has published numerous scientific articles on the topic of fetal development.
Hi, Dr. Demianczuk. How are you doing today?
Oh, I'm excellent, thank you. And yourself?
Oh, very good. Thank you very much for asking. So thank you very much, first of all, for agreeing to appear on our ManyViews.com webcast today. As you know, the topic of our discussion will be fetal well-being. Sort of now having discussed some of the tools we use to actually assess fetal well-being, I'd like to move on to some of the factors, or particularly some of the external factors which might lead to a negative impact on sort of the health of a fetus. So I guess maybe specifically talking about maybe sort of what sorts of factors.
Sure, there's many. There really are very, very many. And I think the first one that we will try to identify when we meet with the mother early in the pregnancy is drugs.
Okay.
Medications. Is she exposed to anything that can be harmful to the baby? Okay. You know, there are a list of medications that we consider no-nos. Okay? Give you an example. Accutane. Okay. Causes a lot of fetal abnormalities. We want to know that. We want to get her right off of that, preferably before she gets pregnant. Okay. Is she on, antihypertensive medications like ACE inhibitors? You know, we don't want those to be on board. Is she on medication that some people will use for other medical conditions, but they're called cytotoxic drugs, drugs that we use in cancer medications, you know, that we just don't want the mother to be on. So we call those cytotoxic drugs. Okay. You've heard of thalidomide. Thalidomide is starting to be used for some other issues right now in modern medicine, but should the mother be on thalidomide, we obviously want her not to be on because it causes deformities in the limbs. That's another example. Then there are medications that we definitely don't want the mother to be on, like very high doses of aspirin as an example, because it causes a risk of hemorrhage in the baby. There's medications that can cause abnormalities such as lithium, which can cause neural tube abnormalities and central nervous system abnormalities, poor growth of the head. So we look at the medications the mother uses. Okay. And are they the type of medications that are absolutely contraindicated, and can they be replaced with something else? Okay. Now, sometimes it does happen that the mother is pregnant, is on a medication that is completely contraindicated, but we have no choice, right? And in that situation, we take the risk that the baby may be affected, and the mother has to make a decision if she wants to continue with the pregnancy or not. Okay? That's her choice. Then there's a whole slew of relatively contraindicated medications. The list is endless. Okay. And in those, we have to talk about the mother's condition. Are there good replacement drugs? And if there are, we change them. Okay. Okay. So that's one type of situation that we can look at. Well, smoking. Smoking is another one. A lot of people smoke. And unfortunately, when you smoke, you don't get oxygen into your lungs. Okay. Right? Yeah. It's a form like of carbon dioxide and monoxide. It's like, I hate to say this, sucking on the end of a tailpipe from a car. It's not good for you. Yeah. Nobody wants to do that, and yet we smoke. So I guess most physicians will be against smoking. And we do know that when pregnant women smoke, although we can't say that one causes the other, there is a strong association with what? Poor growth of the baby. So babies of mothers who smoke, and the more they smoke, the smaller the baby. Not necessarily healthier baby, just, it could be not a well baby. There's earlier rupture of the membranes, leading to more prematurity. There's earlier deliveries, again, more prematurity. So, and also smoking can influence what happens with other medications. It can inhibit the good effects of some other medications. So we really encourage mothers to not smoke, and if they do smoke, cut down as much as you can. Every cigarette less that you smoke is better for your baby. Then there's other things that we can think about when you're talking is alcohol. Well, there's a good example. How much alcohol is safe? Well, tell you the truth, none.
Okay.
That's pretty straightforward. Can you get away with drinking a little bit? I don't know. What if you drink at the wrong time, at the wrong moment, at the wrong time in the pregnancy? We don't know when is that moment. We do know that women who drink a lot or binge drink more than 4 to 5 drinks in one sitting, or are repeatedly drunk in different episodes, have a higher risk of something called fetal alcohol syndrome. And what is that? Well, that's a baby that has a smaller head, a smaller brain, may have learning disabilities. Alcohol is associated with changes in what the face looks like. There's different changes in the shape of the eyes, of the space between the lip and the nose. It can also be associated with severe abnormalities in the body. Heart abnormalities are increased, brain abnormalities are increased. So alcohol, especially binge drinking, especially regular use of alcohol in the early part of pregnancy, is associated with abnormalities, and continued use is associated with poor growths of specific organs, especially the head. And it's one of the major causes of what we call microcephaly, a small head.
Okay.
Other things that you can do that can affect the baby, well, let's think about this. That you can do to prevent having real big issues. Getting severely overheated, severely fatigued. So we always recommend that mothers, take everything in moderation. Exercise is really good for you.
Oh, really?
Crazy exercise is not good for you because your heart rate goes way too high and you're feeding your own muscles and you're taking the blood away from the baby. So if you go real crazy, above 140, 150 beats per minute of your own heart rate. If you're way overheated, like really, really hot saunas, that's not good either, because what does your body do? It tries to get rid of the heat by dilating its blood vessels in the periphery, but again, that steals the blood that's going towards the fetus. So, is being outside okay? Sure, but keep yourself protected from the sun. Don't get yourself overheated. Make sure you're well hydrated. If you're doing exercise, it's really good for you. It's good to be in shape. But it's not good to do crazy exercise where you're pushing yourself to the limit. That is never recommended in pregnancy.
Okay, great. Now, having discussed some of these external factors, what about the overall health of the mother? Can that have any impact on the fetus?
It's again, one of the major things that we look at when we see a pregnant woman for the first time.
Okay.
It's a very, very important component of our questionnaire with our first examination. And what we do look for is underlying medical disorders in the mother. And what can we correct, or how can we stabilize the mother the most so she's in the optimal state of health to be pregnant. I'll give you a lot of examples. Diabetes, one of the first ones that comes right to mind. We know in the old days, going back 30 years, mothers with severe diabetes were seldom had successful pregnancies. Either they would get pregnant and lose their pregnancy with a miscarriage, or the babies would have abnormalities, or they would have stillbirth. So now we know that if a mother is diabetic, you have to control her diabetes before she gets pregnant. And the rules are very different for a pregnant woman who's diabetic than a non-pregnant woman who's diabetic. The level of control is very, very different. So we have to be much tighter. Usually they split their insulins into 4 times a day instead of 1, and the upper limits of what is found to be acceptable is very different when you're pregnant. When you're pregnant, you don't want your maximum sugars after eating to be higher than about 7.4, 7.5, and your fasting ones not to be above 5.4, 5.5. So when you have a diabetic, as an example, you need to make sure that her diabetes is under good control, that it's not fluctuating, and by doing that, you will decrease the incidence of abnormalities in the fetus. They have up to 20% abnormalities if the sugars are out of control, and that can be decreased to a normal level with good control. We also worry about the baby's growing, because if the mother is diabetic and producing a lot of sugars in her system, and they're not being well controlled by the insulin, then all that sugar goes towards the baby, and you can get either two situations: a huge baby, a very big baby, what we call macrosomia, large organs, macrosomia, or you can get a baby that's not growing very well because the mother's underlying diabetes has caused damage to her blood vessels. And these blood vessels are now blocked, and there's no good circulation, and you get the inverse of macrosomia, which is intrauterine growth restriction, which means a baby that's not growing very well. And in diabetic mothers, babies are always at risk of stillbirth if her sugars become very, very out of whack, and she goes into something called ketosis. That's a very abnormal state for the mother that can affect the baby, and the baby can even result in a stillbirth. Other medical conditions that we always check for is hypertension. Hypertension is really important because hypertension, again, the blood vessels are tight. That's why there's high blood pressure, and the circulation towards the baby can be affected, so we need to make sure that the blood pressures are under good control. And we also have to find out, why is the mother hypertensive? Does she have an underlying disease that causes those blood vessels to be tight? So collagen diseases, things like lupus, you may have heard of, rheumatoid arthritis, sclerodermia. Those are very important underlying diseases that can affect the baby's condition and the baby's health and well-being. Okay? And then things like I mentioned before, severe asthma. We need to have that under control so she can breathe properly. Does she have colitis or Crohn's? That needs to be well controlled so she's not hemorrhaging and isn't anemic, so that there's good flow towards the blood, towards the baby, and also does she absorbing all the good nutrients through the intestines that can feed the baby. So all of those need to be under good control.
Okay, great. So now, sort of moving on to the flip side of things, are there what sorts of things can a mother do to try to help improve or maximize the well-being of her fetus?
Well, the first thing that we say is plan for your pregnancy.
Okay.
That's absolutely numero uno. If you know you want to be pregnant, you can plan for your pregnancy. And what does planning for your pregnancy entail? It entails a lot of things. Number one, go see your doctor. Make sure they do a good physical examination and see if there are any conditions that need to be treated before you get pregnant. Everything from tooth decay that needs to see a dentist. I prefer to do it before and after. You still need to do it in pregnancy. Control your blood pressure, make sure your sugars are fine, make sure you're not anemic. All these other things that I spoke to you about just previously. Also, you can prepare for pregnancy by decreasing or eliminating the conditions that can cause stress to the baby. Smoking is a good example. Alcohol consumption. Because you hardly ever know when you get pregnant. You only know weeks afterwards, and the organs get formed in the first 8 weeks. Oftentimes, women don't know they're pregnant before 8 weeks. So it's important that you plan for your pregnancy, eliminate the alcohol, eliminate the medications, eliminate any drug use, eliminate or decrease your cigarette smoking. The other thing that you can do is you can prepare for your pregnancy by using some medications which we recommend, which are folic acid. Folic acid is a medication that prevents neural tube defects or open spines. And that's a really severe condition. It can have long-term and lifelong effects on the fetus. So we always recommend that mothers be on folic acid. Well, folic acid is a medication. And it's a medication that can come in prenatal vitamins. And there's a low dose of 0.4 milligrams. And you can take that, which is fine, in preparation for a pregnancy. Or you can get folic acid itself. And you can use folic acid at 1 milligram per day. Or if you've had a condition before, like a fetal anomaly, or you've had a previous baby with a neural tube defect, then in that circumstance, you may want to have a higher dose, like 5 milligrams of folic acid.
Okay, great. Now, Dr. D, I have one final question for you here, and in addressing our viewers. If anyone who is watching this video is looking for some more information or detailed information on either fetal well-being or even pregnancy in general, are there any reliable or accurate online resources that they can turn to?
Internet is a tool. And you can get a good hammer, you can get a bad hammer. And you got to be very careful on what you read and how you interpret it. The best reliable sources are sometimes the one that have the biggest words and can scare you the most because they have the most information. That is so true. But sometimes that's better, and at least then you have something you can discuss with your doctor. So I would always encourage you to look towards the major societies that publish reliable information. Sometimes too much, but you can always clarify the information with your physician. The sources I would send you to, first of all, would be the internet site of the Society of Obstetricians and Gynecologists of Canada.
Okay.
And in their site, they have something called guidelines.
Okay.
And they have also statements, opinion statements. So what you can do is you can look through those and as they relate to pregnancy, because it's obstetricians and gynecologists, and there's a whole section on obstetrics. And there's whole segments on fetal well-being, on current recommendations about the use of medications, etc. So that's a very, very good source. We have an equivalent in the United States of the major obstetrical society in the United States, and that's called the American College of Obstetrics and Gynecology, ACOG.
Okay.
And it's acog.org.
Okay.
And again, that's a superb site with an endless amount of information that you can pick out according to your own needs. Okay. The other two sources that are of use, one is called MOTHERISK in Canada.
Okay.
And it's an excellent source, and it basically deals with the use of medications in pregnancies and what is safe and what isn't.
Okay.
And how much of what is safe and how much of what isn't. And that's a very, very good source. And another site that I would, again, I know has very accurate information is CDC. It contains accurate information in obstetrics about different recommendations of how women should handle themselves in pregnancy.
Okay, perfect. Well, Dr. D, I'd like to thank you very much for this very informative talk on this very important topic. And for our viewers, you've just heard some online resources that you could turn to if you're looking for even more information on this topic or other topics related to pregnancy. So thank you very much.
Paul, thank you. It's been a real pleasure.
Great, thank you.
Bye-bye.